Hi everybody, I'm Dr. Christy Harpel. I'm the owner of Health by Design, a wellness center here in Jacksonville, Florida. And I was lucky to be able to talk to everybody today. I felt like it was very timely because the question we pose right now is there or should there be a new normal for our health? And so we're going to just reflect a little bit on what we've learned from COVID-19 and this pandemic that we're kind of still in the midst of. As I've been researching this topic for the last 2 months straight, I've listened to all sorts of pastors, I've listened to medical doctors, researchers, epidemiologists, I've listened to professors at some of the top medical teaching institutions across the country. And one of the most profound quotes that I heard was that, "Isn't it crazy how something invisible like a virus can shut down our entire visible world?" So let's talk about first, do we need a new normal? And so let's talk about BC, before Corona. If you can remember back that far, we already knew that our current healthcare system wasn't working very well. We knew that people were living longer with more chronic health conditions. We also knew that our healthcare costs are amongst the highest in the world and very highly contribute to our national debt. And yet we rank number 40 as far as overall health in the world. We know that the United States consumes 80% or more, it's even predicted at this point, of the total world's pharmaceuticals. However, we're still sick. Our health statistics as a nation have not improved despite all of the money and time and resources that we're putting into healthcare. So what I'm going to pose today is that the root of the problem clearly hasn't been addressed, or we would be a lot healthier. So in order for us to have a conversation about what would be our new normal, let's talk a little bit about what isn't normal. So this slide has a ton of information on it. So let's just talk a little bit about each of the graphics. So masks, is that going to be part of our new normal? I've had people ask me, like, is there any end in sight? Is this just going to be like get used to wearing masks every time we go somewhere? The news, like just constant posting about fear and panic. And I hope everybody knows that when you turn the news channel on, that's only a small snippet of the whole overall story. There's no way that the news can cover anything in total. So it is important that you do your own research and you look elsewhere to gather information about what's going on in the world. Gloves, we've covered this. There's so much misuse of gloves. I think people get a false sense of security when they have the gloves on. They think that they're protecting themselves, but you see all sorts of opportunities for cross-contamination. People will use their gloves in the grocery store and touch items and then touch their face. And especially since people have the masks on, they're uncomfortable, so people are repositioning the mask with their gloved hands that they've already touched a bunch of other things. You know, then they'll go back to shopping or they'll exchange money, and then they pick up their cell phone, and then they leave the store, and they leave the same gloves on and touch their car and touch the steering wheel and all the things that are in their vehicle. And so you're spreading contamination if you're not changing your gloves out from time to time. Testing, they've really retracted a lot of the information about testing. There have been false positives. They did tests in New Zealand on fruits and animals, and they got coronavirus positive results. The statistics that have come out of some of the testing has definitely shown that they changed the statistic numbers and that they aren't looking at the same numbers that they look to predict the flu epidemic, for example, from year to year. So there's a lot of falsehoods in that you need to really understand the numbers, and the numbers that they came out with in the beginning of this 2 months ago are not the numbers now. So everybody needs to realize you need to shift your thinking along with the new information as it comes out. I don't think microchipping is normal. I definitely don't think 5G and surveillance is normal. The safer at home and the social distancing, what most people don't know is there's not a whole lot of science. We don't know where that came from. There's no science that shows that 6 feet is sufficient to stop the spread of coronavirus. However, everywhere we go, whether we're in line or we're in restaurants, businesses are opening back up at 25% capacity. None of that is based on science. And then, as we can see, something invisible like a virus has closed the entire world. So let's just stop and reflect on these are not normal, and should we want those to be our normal going forward? So lo and behold, as I studied all these epidemiologists, medical doctors, and researchers, and pastors, and colleagues, the new normal is what has always worked. It's what your mother and your grandmother have told you forevermore that always worked. You should wash your hands. You shouldn't touch your face. Things like vitamin C and zinc and vitamin D, these aren't, any kind of new nutrients to boost your immune system and keep you healthy. That we should take special precautions around the elderly and people who are immune compromised. That we should eat healthy and exercise and reduce stress. All of these things reduce comorbidities. So what we know with the data is that the people who had the worst statistics or worst outcomes with COVID-19 were people who already had comorbidities or current chronic illnesses like diabetes or obesity. So there are things that we can do, and these are not new research, guys. These are things that just normal healthy living. So this virus, the pandemic, responds to what has always worked. So that's actually very good news for us. So today I'm going to pose to you that nutrition response testing, something that I do every single day in my practice here in Jacksonville, is the new normal and is the answer to a lot of the questions and fear and panic that people have found. And nutrition response testing is based on kinesiology, which is the fancy word for muscle testing. And with the quick push on the arm in the office with some really advanced training and some really cool resources and technologies that we have, we can really eliminate the guesswork for people. And so I think people are just guessing. Are the masks really, providing as much protection as they thought? Are gloves the way to go? Should we use hand sanitizer every 5 seconds? Does the staying at home thing really work? The 6-foot distancing? So that was all guesswork that people speculated in order to try to flatten the curve. But nutrition response testing, we say, why guess muscle test? So it eliminates the guesswork very quickly. With nutrition response testing, we also work on boosting people's immunity naturally and also decreasing comorbidities. And so what we found with our population of patients was that they didn't have positive tests. They didn't run to the emergency room. Nobody developed upper respiratory infections because their outcomes were better than the average standard American normals because they don't match the statistics. They're doing better than and are doing more than the average population is doing to protect their immune system. The other really cool thing that I thought came out of surveying our patients during this time was that by being part of nutrition response testing and being on a nutrition program and plugging into a community of like-minded people who think like us, who want to get to the root and be proactive and prevent sickness in the first place, was that our patients reported having an increased sense of hope and empowerment over their overall outcomes. And that was because they had confidence in their body to perform the way it was intelligently designed to perform in the first place. And they didn't have the same fear and panic that people did when this whole first thing started up 2 months ago. The other answer from nutrition response testing is that it's individualized. And so we can really avoid that cookie cutter approach, and the body will tell us with the muscle testing exactly what you need. And so we can customize a program specifically to your needs. So you no longer have to guess, do I need vitamin C? Is vitamin D the right thing? Am I zinc deficient? We can tell that with a muscle test. Nutrition response testing helps us to improve the overall health of the body rather than managing the symptoms. And so have anybody told, like, wait and see? I often ask, like, well, what are you waiting for? Are you waiting to inevitably get sick and then try to manage those symptoms? So we want you guys to know that your body was designed for so much more than that. So we want to improve the immunity so your body will protect you. And then getting to the root of the problem, there's all sorts of different things that can lower your body's natural defenses. And so with the muscle testing, we have some test kits in the office, and some common things that could interfere with your body's natural defenses are food sensitivities. So we can identify very quickly what foods might be causing inflammation and stress to your system, so you know what to avoid. We can also tell if your body's having trouble handling immune issues. So if the body's defenses can't defend against things like viruses or bacteria or yeast, fungus, and even parasites, we can put patients on a protocol for that. Heavy metal toxicities are something we test for, and then also toxic chemicals, and those can come from the foods we eat, the beauty products we use, our cleaning products, and then just simply air and water. So unfortunately, our world is toxic, and eventually the body needs a little support to overcome that. So if this sounds like something that you would like to experience yourself, I always say muscle testing. I will give you a demonstration. I think that even the most advanced practitioners and even patients who have the best success stories have trouble explaining what the muscle testing is and how it works. So I'm going to demonstrate that for you guys in a minute here. But of course, I would love for you to come in and experience this yourself. So if you go to this link here, this is an offering for all of our Summit watchers. We appreciate you. We're happy that you're tuning in and looking into holistic measures to take care of your body overall. If you go to healthbydesignfl.com/free-discovery-session, there will be a link for you to come in for a free health screening so that we can just have a conversation and find out whether or not you are a good candidate for this type of healthcare, and whether or not something like diet and nutrition and something natural and non-invasive could be a potential solution for you in whatever health challenges that you're having. So I encourage you to take advantage of that link. Okay, so we have Andrea here, and so she's going to be our demonstration today. So with muscle testing, first I'm going to show you the muscle test. So as Andrea's standing here, she's not under any kind of direct stress or anything. So if I were to push down on her arm, she's pushing up into my hand, just matching my pressure. And so that's no problem. When her arm stays solid like that, that's called a muscle lock, okay? In the testing, all I would do is put light pressure over the surface of her body, over her organs. And when I do that, we're either going to get what we call a lock or an unlock. And everybody's unlock is a little bit different. Some people, it's going to wiggle all around, and other people, it's going to go down completely. So we're going to show Andrea's lock and unlock first. So there's an acupuncture point, kind of like an on and off switch, right on the bridge of your nose. So when I touch with one side of my finger, we should get her lock, and we do. And when I turn my finger over, we get the unlock. And she's easy to test, so that's great. So now with the screening, all I would be doing is putting light pressure over the organs. And so if I were to get an unlock over an area, that would indicate an area where there's already some kind of weakness, okay? And the way this works is kind of like hypothermia. So I'm from the north, so we all know what that is. But in hypothermia, what the body decides is, say your lung, for example, your lung is more important for your overall survival than, say, your arm. And so if there was already stress to her lung, her body would sacrifice her arm to keep and maintain the blood supply to the lung. So that's how that would work. So if there was already a weakness in her lung and I touched, we would get the unlock, okay? Then what we do is, and you'll see this in our offices upstairs, we have all these little test bottles that have sample bottles of the whole food nutrition. And these are in glass bottles. So the energy of the nutrients, because it's living nutrition, can come through the glass and her body can sense it. So what we would do is have her hold this and just put it in her energy field. And if that was in fact the exact right thing for her lung, this time I would get the lock, okay? So the way that works is very similar to the way the sun's rays, the energy of the sun comes through the glass of the windows. It's just that that's like a billion times stronger than the energy of the supplement. So it's a little easier for us to perceive. You know, we can feel it on our skin and we can visualize the rays. We can't sense this with our senses, but our body's nervous system is sensitive to detect it. And so we would go through a whole entire screening like that on all the organs. We would test for potential interferences that we listed, like the foods, chemicals, metals, and immune challenges. And then we would come up with a customized, individualized program for the patient, depending on what exactly shows up, whether we need a detox or heal the gut or avoid certain foods. And so That's nutrition response testing. That's how it eliminates all the guesswork. We say, why guess? Muscle test. Okay, everybody, so that was our demonstration of muscle testing. Again, like I said, it's so much easier to do it when you to feel the lock and the unlock on your own body. And so that's what we're going to offer for anybody who is listening in today to the summit. Thank you so much for joining us. We have this special offer for all of the listeners. If you just go to our website, healthbydesignfl.com, and then it's /free-discovery-session. And we'll bring you into the office. You can meet us and meet our friendly staff. We'll do the lock and the unlock and do a quick health screening on you and just determine whether or not it's worthwhile to take the next steps together. So we'll determine in that session very quickly whether or not any health challenge that you're having could or couldn't be helped with nutrition response testing, and if you're a good candidate for what we do. And it's been a pleasure speaking with all of you. You can also contact me through the website. So if you have any additional questions or comments, I'd love to hear from everybody. And have a great day. I hope you navigate this world with ultimate health.